Welcome to the mock counseling session for habits. And when we say habits, oral habits, I am Dr. Fawaz Devi from Department of Pediatric Dentistry, and I'm going to do a very small presentation on how to conduct a counseling session for parents who have children who have some kind of habits which is causing a problem with their dentition, with the occlusion of the dentition, and therefore, when we say we call it as deleterious habits. So this presentation is basically for year 3 semester 2 students when they come into their second clinical posting in pediatric dentistry. But as a whole, this can be a very good starting point for anyone who is looking to counsel parents who have children who have got some kind of habits. So let's begin. Good. Um, I want you all to have a look at the two pictures that is present on your screen, and let me get this arrow done. Okay, so now this is a 9-year-old patient who reports with a chief concern of a malaligned upper front teeth. So as you see in this clinical picture here, there is a malalignment according to the patient. More technically, this is called as an open bite. And the second picture is of the two thumb of the child. So during your case history taking, you normally ask parents if they have any habits, and out of curiosity, when you look at an open bite, always look at the thumb of the child. So my question to you is, can you connect these two pictures and tell me what is the connection between these two pictures? I'll give you some 5 seconds to think over it and think of the answer, and then I'll tell you the answer. Okay. So all of you who've got this right, the open bite is because of the thumb sucking habit. And what we look here on the thumb is the callus, which is an indicator of the constant friction the skin of the thumb is facing because of the upper central incisors, or it could be lower central incisors, depending on how the child is putting the thumb into the mouth. So we have a case scenario here where the child is having a thumb sucking habit, which is causing an open bite to the child, and until we stop this habit, this open bite will remain forever, and this will get converted into a tongue thrusting habit, and whole lot of things can happen which will be very difficult for the orthodontist to handle in the future. So this scenario can be presented to you as your OSCE question, and you will be asked to demonstrate how you will conduct a counseling session with the actor who will be sitting in the station for you to talk to. Okay, so this case scenario could be a very good clinical OSCE live station, or it could be actual patient that you face in your clinic. So be prepared for it. So before we start, we need to understand what are habits. So habits are basically something you do automatically. All right. So habits are something you do automatically, consciously or unconsciously. So this habits has been a topic for interest in pediatric dentistry for a very long time, and the people have classified habits in a million of ways. But very simply put, habits can be of two types. One is the deleterious habits, and the other would be obviously be the opposite, would be the good habits. Deleterious habits is any habits which causes damage to the human body. Okay, so when you talk about oral habits, so any habit related to the oral cavity which is causing damage to the body is a deleterious habit. So some of the habits I've listed out for you there: thumb sucking habit, pacifier sucking, nail biting, mouth breathing. So all of these have got deleterious effects on the dentition, and they will produce malocclusion. And also you'll have deleterious habits in general. You've got a very bad um, drinking habit, or eating habit. Okay, and opposite to deleterious habit are good habits, like brushing your teeth every day, right? So it's a habit. So you every day you get up and you're drawn to the washroom to brush your teeth, so it's a good habit. Or if you have a habit of exercising every day when you get up, or in the evening you go for a swimming for every day for half an hour, those are kind of good habits. So our focus here is the deleterious habits. All right, so whenever you're faced with the question of habits, the bottom line again here is habits can be because of psychological issues, or it could be because of non-psychological issues. Okay, the typical example that I like to give everyone is the thumb sucking. Okay, so on the face value, thumb sucking is a very simple deleterious habit. The child puts the thumb into the mouth, and then all you need to do is remove the thumb from the mouth, and then the open bite will close and things will settle. But it's not like that. And thumb sucking is one of the very, very difficult habits to break because it has got a psychological portion to it. So whenever you are discussing habits in your assessment of the problems, you need to differentiate between psychological issues and non-psychological issues. So back to the thumb sucking habit. Thumb sucking habit has got a psychological issue where the child feels lonely. He is carving for attention from the adults. He's scared, so they normally suck on the thumbs to comfort themselves. Something which comes from the oral stage of Sigmund Freud's psychodynamic theory of development. So that is how the thumb sucking is. Or the thumb sucking is something which has non-psychological issues. So there is no carving for the thumb, but since the child has been doing thumb sucking for 6 7 years, um, the habit is almost automatically. So the child is watching a TV, the thumb automatically goes into the mouth. Okay, and he's unaware, and the mom is like, "Hey son, your thumb is in your mouth again," and he's like, "Oh my god, I never realized how I started on that." So these are the two kind of issues when you're dealing with habits. Like another example that I give is the people who have a habit of smoking, right? So it's got a very strong psychological issue to it, and of course there are certain non-psychological issues like peer pressure, or just the availability of the cigarette is there because the father is smoking, so they just get addicted to smoking and then they start continuing on it. So and the reverse would be a psychological issue: a person who under tremendous stress, under divorce, having a bad relationship, so they take to smoking as an outlet for their emotional stress. So whenever you're looking for habits, you have to differentiate between the two, psychological issues and non-psychological issues, because our interventions are different for each of them. Okay, so let's see how we do the counseling. All right, so this is the counseling process, which is basically the 5 steps that we have been talking about in the previous mock counseling sessions also. So first and the foremost is you establish rapport with the parent. All right, so again, you need to smile a lot, you need to show some concern, you need to show some warmth in your body language, right? You have to give a listening ear to the parent, and once the parent realizes that yes, the dentist is showing a deep concern for my child's health, so I need to open up. So when you realize the ice is broken, so you go to the next step where you assess the problem. So when I say you have to assess the problem for any habit, you have to basically assess whether it is a psychological issue or it is a non-psychological issues. Okay, a very, very typical example I give you is for the thumb sucking. So thumb sucking has got a psychological issue, right? So the child is feeling lonely, the child is scared, so he starts to suck on his thumb. Or the child is having stress, he's having a bad day at preschool, he starts sucking on his thumb to kind of relieve his stress, or thumb sucking becomes a coping mechanism for him. So in such children, right, if you try to put some bitter tasting liquid on the thumb, hoping that the child will get the bad taste and he will leave the thumb sucking, so you have heard so many cases that the bitter tasting does not work, and this is the reason why it does not work, because there is a psychological issue to the habit. The opposite would be a child has had a very mild thumb sucking habit all through his childhood, and now he is into school age, 10 years old, 11 years old, and he still has this habit of putting the thumb into the mouth, and the habit is so mild that it does not really create any malocclusion. So for such child, okay, you can put a bitter taste, because now these children who are older, 9 10 year old, they need a reminder therapy that the thumb is into the mouth. So you can put some bitter tasting liquid on the thumb, or you can give them an orthodontic appliance for them to remind them that the thumb has gone into the mouth. So you can do that for them. But a child who's using thumb sucking as a coping mechanism for his stress, and if you give him the appliance, okay, you cement a tongue spike or partial crib appliance into such this patient, these patients will get more irritated, right? And you will certainly find that these patients report after every 2 weeks, 10 days with a broken appliance. Okay, and you are wondering that why is the appliance getting broken every time, and then you have to realize that the child has got a psychological issue with the thumb sucking. So this appliance therapy will not work, because every time you put an appliance, he uses up his pencil and he tries to remove the appliance because it is causing him hindrance in his coping mechanism with the stress. So in these children, if you relieve the stress, the habit breaks off, right? And very typical example I give you: the child starts to go to preschool. He suddenly starts on this habit of thumb sucking because he doesn't like his school teacher, or maybe the school teacher scolds him and the school is not nice, and he needs the time to adjust, or the mother is not able to give time to the child, um, and the child feels lonely. So in these cases, you have a different kind of suggestions. So here, so you assess the problem, you ask the relevant questions, you ask the appropriate questions: what, where, how, when, which, and you have to analyze everything and come to a stage of problem solving where you say, okay, this is a psychological issue and we need to look at the psychological aspect of it. So once you have done the psychological, non-psychological differentiation, you go to the next one and you have to set the goals for the child to achieve. So again, thumb sucking habit. So you just tell the parents that you something like you put up a calendar and you tell the child that every day that he doesn't suck his thumb from 2 to 5, okay, he's gonna get a star. And if he collects star for 7 days in a row, he gets a small gift. So right, it's a kind of a motivation for the child to stop the habit on his own. Again, this would work for the children who have got a non-psychological issues, not for the psychological issues. But you have to set such kind of small goals for the child. Okay, maybe you talk about a nail biting habit. So you make an agreement. You ask the parent to make an agreement with the child that in the following week, from 2 to 5, you will not bite your nails, and if you bite your nails, I'll give you a signal. Okay, maybe I'll just clap 3 times, and that would be a signal that you're biting your nails and you need to stop it. And suddenly you find that the parents are like, okay, this can be done, I can do this to help my child. So it's a small goals that you set for the child. So then the bigger goal will be from 2 to 5, then you go to 2 to 7, then you go to 2 to 9, and then you try to do it for the whole day, and you set such goals for the parents. So here you have to set small achievable goals for the parents and for the child also, right? So don't burden the child saying that for 24 hours you don't suck your thumb, you're gonna get a star. So the child will be like, oh my god, for 24 hours if I don't suck, I get 1 star, and at the end of the week I'm gonna get a Cadbury chocolate. It's not worth it. Okay, so you have to set small goals, realistic goals. So after you set the goals, you have to come and offer the suggestions. And when you talk about the suggestions, like I said, you need to talk about the psychological problems and non-psychological. The psychological problems are very difficult to solve because you really need to go into the depth of the child's life experiences to dig out what is troubling the child. Okay, so some of the most common issues here is that the mother is not able to give the attention to the child, or the child is single in the family and the parents are working and the child is with the caretaker. The child is just missing his parents. So all you need to do is you tell the mother, to put the child to sleep, and you cuddle the child to sleep. Okay, and you suddenly find that once the child finds the mother, he forgets the thumb. So these kind of realistic things you can suggest to the parent, right? You ask the father to spend those half an hour, 1 hour of the evening with him to play. So during the time he's playing, he forgets his thumb and he remembers his father. And then you will eventually find that he has lost interest in the thumb because he has found new interest in other things like playing with the father or playing with the mother and things like that. um, on the opposite side of the spectrum, we have children who want to stop the thumb sucking habit, but they just cannot because it is such an automatic habit. So in those situations, you can go for reminder therapy, you can go for orthodontic appliances, right? So if you have a child with nail biting habit, you can put a bitter tasting solution on the nail, so to help prevent that. But again, when we talk about nail biting, it can be because of the stress. So the child is so stressed, starts biting on the nail, right? Typical example is that when you're scared, you start biting on your nail. So this is emotional, right? Psychological. So if you never get scared, you will never bite your fingernail. So here, you have to do this the differentiation very very properly to offer the correct advice, correct recommendation. Okay, so here on one side you can give appliance therapy, reminder therapy. On the other side you need to look deeper into the child's life to discover what is the source of trouble or the source of stress, and then you suddenly find children with psychological issues. You remove the stress, the habit disappears on its own. So we have to give the suggestions. Again, don't give too many suggestions. Give maximum of two suggestions, doable suggestions, and you call the parent back after a week or a two for a review, and then you again do your periodic evaluation. That is the last step, and you ask the parents how things went. Did the suggestion work? Did they find? Did they have any trouble? And then again you modify your suggestions and you put in more suggestions. So in the whole counseling process, you must remember that you're partnering with the parents in trying to create a good dental health for the child, and your counseling session may work, may not work. Okay, typically the parents will come and they will pester you for an appliance to give, right? And they feel that once appliance is in the mouth, the child will forget it, and then they will keep pushing you to give an appliance, to give an appliance, to give an appliance. And if you give an appliance and the appliance starts breaking, or the appliance starts um, not working, then you need to remind the parent that during the first counseling session we had discussed this, that your child is having some psychological issues and we will try to solve that and the habit will break. So things like that will happen. So it is very very common with thumb sucking habit, or with the nail biting habit, or the tongue thrusting habit, that the parents wants to have the orthodontic appliance to as a full stop to the habit, but rarely happens. The habit takes about 3 months to break. Okay, so the normally of course the details of the all of the habits you will learn in your lectures on in orthodontics, but here we're just concentrating on the counseling process. So you need to be patient to see changes that happen in the child's life regarding the habit. Okay, so with this, I end this small presentation on a mock counseling session for oral habits. I hope you find this presentation useful, and I look forward to seeing you perform this when you are posted in the department. And do share your reflective writing on this with us, and so that we can sit together, and you will be surprised that you discover so many things that you never knew the parents would do to the child, or the child has to go through in his or her life. Okay, so use this experience as a learning experience, and do share with us through reflective writing, and we will discuss how you have done and how you can improve on that. Okay, with that note, it's goodbye from me, and see you in the clinical posting.